My name is Jeff Linder. I'm a gastroenterologist. I grew up in Oklahoma, northern Oklahoma, about as far north as you can get before you get into Kansas. After leaving Oklahoma, which is right after high school, I went to Texas A&M for college. Then I went to University of Texas, Houston for medical school. Then I went to Birmingham, Alabama for my GI fellowship, and eventually went up to Milwaukee for my advanced therapeutic endoscopy. What drew me to medicine is an interesting story. When I was 12, I got cut by a chainsaw on my right hand, and it was on a Good Friday. And in the small town where I grew up, there's not a lot of medical facilities. There's one hospital, and there was somebody that was injured more than I was. So I sat around the emergency room for a very long time, about 5 hours. Well, as a 12-year-old kid, I got kind of bored, so I just started roaming around the hospital. Eventually, I appeared in this room, and some guy was looking through a little instrument here doing a procedure, and I just stood there fascinated. And he looked up and he saw a little 12-year-old kid with his hand bandaged up with a whole bunch of paper towels, and he said, "What are you doing?" And I said, "Well, I'm waiting to be seen by the ER doctor." And I said, "What are you doing?" And he goes, "Well, I'm doing a colonoscopy. Would you like to watch?" He invited me in to watch, and I decided at that point I was going to be a gastroenterologist. One of the funnest things I do is that I'm a semi-pro fisherman. So I do bass fishing during about 6 months out of the year. In fact, in April, we'll be going to a national tournament on Table Rock Lake. So that's hobbies I have. I also play the guitar. I'm an avid sports fan. I'm a 100% Dallas Cowboy fan. I've been so since I was young. And I'm married to a Green Bay Packer fan, so it can be difficult in the house around football season. I'm a gastroenterologist in a practice called the Digestive Health Associates of Texas. We're 79 gastroenterologists, all in the DFW Metroplex. We take care of all kinds of diseases related to the gastrointestinal tract. We have offices in Fort Worth. We have them in Plano, McKinney, down south into Duncanville. So we're really all over the Metroplex. We have endoscopy centers that are convenient and allow people to get their procedures without having to drive too far, and also without the hassle of going into a hospital where the stay may be up to 2.5, 3 hours. So by using our endoscopy centers, you're able to get in and out a lot quicker. When I had been practicing gastroenterology for about 2 or 3 years, I had really become emotionally detached from being on the same wavelength as the patient. Because of the specialty that I have, you run into lots of cancers, and sometimes it's just heart-wrenching that you have to tell a family member that you have cancer, and in some cases, maybe inoperable cancers. And at first it was very emotional for me, and over time I became hardened like most physicians do. They deliver the news and then they retreat so they don't get too emotionally involved. I've been in practice now for 13 years, and about 5 years into my practice, there was an old couple. They were in their late 80s, early 90s, and I had met them that same day, and they were there for a pancreatic mass. They hadn't been told that they had she had pancreatic mass, and my duty was to diagnose it and tell them if it was removable or not. So I did find that it was a malignant mass, and unfortunately it wasn't removable. So I went and I told them just exactly like that. You have a pancreatic cancer and it's unremovable. And then I tried to retreat before I got too emotionally involved. And the patient grabbed me by the arm and said, "Listen, son, I want you to sit here and act like you're the patient and tell me how you'd want to be told." And since that moment, I've always treated every patient just as if I were in their shoes, how would I want to be told? Standards in medicine have become extremely important. Gone from the days in the 70s and 80s where the physician's word went and you had no saying in it, and nobody policed physicians. But now it's all standard-based medicine. In fact, the government is eventually going to tell us that if you don't meet standards, then you're not going to get reimbursed for anything that you do. Every single practice or subspecialty has their own set of standards. For example, in my field of gastroenterology, we have standards for colonoscopy, for example. We monitor how long does it take you to pull the scope back and examine the colon. Some physicians do it too quickly. They get to the end and say, "Oh, I'm done," and 30 seconds later, the procedure's over and they didn't really look at anything. So we have to document how long that you withdraw the scope, and it's supposed to be 6 minutes. So 6 minutes is the goal. And that studies have shown that that gives you adequate time to find polyps and remove them. Also, standards now in gastroenterology is that we are monitoring the number of polyps you find. That tells us whether or not you're a good gastroenterologist. Are you doing the job adequately? Colon polyps in some studies occur in 15 to 25% of patients, 15% in women, 25% in males. However, recent studies additionally have shown that it may be up to 40% of people that have colon polyps. So that's a standard that we really monitor, because if you're doing colonoscopies and you're not getting at least 15 to 25%, that means that you're not doing your job. It's important to me to be a top 10 MD. Too long have gastroenterologists and other physicians failed to market themselves and connect themselves with the patients that really need them. Too many times do I get patients that come in and they've gone for years and years of just looking up on the internet and treating themselves, instead of looking up things on the internet and then finding somebody that can help them through that in a correct medical way. So Top 10 MD helps put me in touch with the patients that need my help.